Hi, my name is Alexis and I will be talking to you about contrast media. In the world of radiology, we use two different types of contrast, either radiolucent, which is negative, or radiopaque, which is positive. I will be elaborating on positive contrast media, more specifically barium sulfate. Barium sulfate is an inert powder that is composed of crystals. It can either be ingested or injected into our bodies. Once inside our bodies, the barium will appear white on X-ray images. As the barium is traveling through our system, it helps coat the lining and inner mucosa of specific organs, making it easier to diagnose and visualize specific pathologies. Barium is not water soluble, therefore it needs to be mixed with water to create an oral suspension. That way it is concentrated enough that the X-rays are absorbed and we can avoid flocculation, or also known as clumping. Barium is used in a wide variety of exams, which are not limited to but include exams such as esophagograms, upper GI series, small bowel series, lower GIs, and barium enemas. Those are just some of the examples of the exams in which contrast barium is used. Barium sulfate in certain patients can cause a wide variety of complications. If we have a patient that is believed to have a perforation in the bowel, we cannot give him barium, because if the patient is given barium and it is ingested, then the barium can leak into the pelvic cavity and it can cause peritonitis and will have to be surgically removed. This happens because our bodies do not naturally absorb barium. In that specific case, we would have to give the patient an alternative such as water-soluble iodine contrast agent. Not only can barium cause complications in some patients, but it can have adverse reactions. The most common reaction after ingesting barium is constipation. It is the most typical with all patients, if they usually tend to get constipated. So that's why we advise them to drink plenty of fluids after ingesting barium sulfate. Sometimes the constipation is so severe that it can lead to a perforation of the colon with extravasation, which means the barium has leaked into the abdominal cavity, causing barium peritonitis. Patients who are typically at risk for this type of adverse reaction are older patients that are on long-term steroid medication or have already diagnosed gastrointestinal problems such as diverticulitis or ulcerative colitis. Patients who have had recent biopsies in the colon and or sedated patients are also contraindicated for lower GI examinations because of the high possibility of bowel perforation. Overall, barium is a very useful and necessary contrast agent in the radiology department. But I believe us as technologists should do our job prior to preparing the barium in a way such as taking a detailed patient history so that we can avoid complications during the exam. Not only that, but as we prepare the barium, we take all the proper precautions and follow the proper procedures as we're preparing and instructing the patient on how to drink it. Thank you for tuning in, and I hope you have learned some very important information on barium contrast. Once again, my name is Alexis, and thank you. Have a great day.